Okay, so good evening, everybody. My name is Patrick McKeown, and going to go through all of the breathing exercises as it would pertain to respiratory conditions. Our motive for putting this together is based on the current COVID crisis. Coronavirus, this is not the first time it has been around. We did have a family strain of this back in the 2003-2004. There was research back then published in 2005 looking at nitric oxide and how it could inhibit the replication of coronavirus. And back then it was SARS. COVID-19 is also a coronavirus. COVID stands for coronavirus disease 19. Now, a number of things that I'm going to go through. One is, what would you do when your breathing gets labored? Number two, how can you breathe to improve oxygen uptake in the blood? So if you do have issues with your lungs, what's the best way to optimize ventilation? That if your lungs are compromised, and even if you do have a pre-existing condition, what's the best way to enhance alveolar ventilation? Another aspect that we will look at is measuring your breath hold time, and also then practices that you can bring into your daily life. So one of the symptoms of COVID-19 is breathlessness. And since 1975, researchers have known that using breath hold time, you can measure the degree of breathlessness. And the most important breath hold time that you would measure is the one that you measure first thing in the morning. As soon as you wake up, sit on the bed, allow your breathing to recover, and measure your breath hold time. If your breathing is labored, your breath hold time is reducing. An optimal breath hold time would, of course, be 40 seconds. Does everybody have it? No. Functional breathing tends to be when your breath hold time is above 25 seconds. And suboptimal breathing is when your breath hold time is less than 25 seconds. So in order to measure your breath hold time, it's not the maximum length of time that you hold your breath for, but it's the length of time that you can hold your breath for comfortably until you feel the first definite desire to breathe, or until you feel the first involuntary movement of your breathing muscles. So to measure your breath hold time, or control pause from Buteyko, it's Bolt score from Oxygen Advantage, you would need a watch with a timer or a second hand. You take a normal breath in through your nose, a normal breath out through your nose. You hold your nose and you time it in seconds until you feel the first definite desire to breathe. Corresponding with that, you may feel that there's an involuntary contraction of the diaphragm breathing muscle, or you may feel that there's some tension in the throat, or you may feel the first definite desire to breathe. So your breath hold time, keep an eye on that in the coming days and weeks and months ahead. COVID-19, one of the recognitions is that when there is a severity or a progression of the disease, blood oxygen saturation decreases. And some of you will remember it if I say the acronym LSD. So you're thinking about light, you're thinking about slow, and you're thinking about deep. And what I would like you to practice is put your hands on either side of your lower two ribs, just where you can feel the base of your lungs where it meets the abdomen. And separating the chest from your abdomen is your diaphragm breathing muscle. So it's by having your hands either side of your lower two ribs, with your lips together, breathing in and out through the nose. What I would like you to do is to really slow down the speed of air coming into your nose. So you're taking a soft, gentle breath in. And as you breathe out, you're having a relaxed and a prolonged exhalation. And as you breathe in, you should feel that your lower ribs are moving out. And as you breathe out, you should feel that your lower ribs are moving in. So as you breathe in, you should feel that your lower ribs are moving outwards. And as you breathe out, you should feel that your lower ribs are moving inwards.